So I guess I'll just start a little bit by talking about myself, giving you a little introduction into my background. So I've always loved healthcare and science, biology, all of that. It's always been a passion of mine. Science was my favorite class when I was just around your guys' age. I was always so interested in how these things work together to help people feel better. So I always knew I wanted to do something in the healthcare field. And because of that, I made sure that, my academics were strong. I tried my best to get all A's or A's and B's. I came to class, I had a good attendance. My teachers knew me, and that was good. It worked in my favor because having strong academics can help you far down the line. The other thing I really liked to do and had a passion for was basketball. I don't know if we have any athletes in here. Yeah, I see you smiling. So I was a huge basketball player. I loved playing basketball. I was on a ton of travel teams. I played AAU, played for my school. I was always playing basketball. And because of that, I worked really hard to get better and to do well because I started thinking in high school, maybe I could play in college, that would be really cool. Come on in, yep, we were just talking a little bit about ourselves. I'm Anne Marie, by the way. So I worked really hard, and I was actually lucky enough to achieve a full basketball scholarship to Assumption College. And I don't know if any of you know what it means to get a full scholarship, but that basically means that they pay for your entire undergraduate career, and college is expensive. It's pretty expensive, but that was pretty cool that I was able to do that. So, I played for 4 years in undergrad, and it was probably one of the most challenging things I've ever done, but it was also really fun. I made some lifelong friends, I still see them every year when we have our alumni game, and it was just great. But after I was done with college, I was like, I still want to do something in the healthcare professions, I knew my sister had gone to pharmacy school, my dad was a pharmacist, so I was like, let me apply to pharmacy school. There's a lot of opportunities. And, I was lucky enough to get into Massachusetts College of Pharmacy and Health Sciences in Worcester. And it's an accelerated program, so, it's a little bit faster than usual. You don't really get any summer breaks or any spring breaks, 2 years and 10 months and you're done. I'm actually graduating in 4 months, I think? So that's where I'm at now. I'm in my final year doing different rotations in different areas to see, kind of what I want to do. I'm really interested in hospital pharmacy, so I think that's the route I want to go to right now. But I do work in community currently.
All right, hi guys again. Thank you for having me today and sharing your lunch with me. This is very generous. I like to eat in silence, so I appreciate you guys taking the time to listen to me talk. So, like Anne Marie, I went to pharmacy school. I finished pharmacy school. I went to UConn for pharmacy school. I finished pharmacy school and started working at Stop and Shop Pharmacy. And I'm currently the pharmacy manager at Stop and Shop Pharmacy in Bristol. So I always knew I wanted to be a pharmacist. First generation African American to go to college and graduate. So growing up, education for me was always huge. But I always knew I wanted to do pharmacy because I knew I wanted to help people. I like to help people. I like to learn about medications, what they do, how a simple tablet can make you go from having an excruciating migraine to no pain at all. So the dynamic of helping people and the exciting aspects of medication and how they work with the body, put the two together, and I felt like pharmacy was the right decision for me. Also, my dad's a pharmacist, let me not lie. So, having that also, it pushed me in that direction. I went to the University of Connecticut, so I'm originally from Massachusetts, honestly. And when I went to UConn, it was kind of tough, to manage the day-to-day of being a college student. It's your first time away from home, and you also have to be ready to put yourself in a mindset to get you ready for your career and the rest of your life. So balancing the two was tough, but I came to class every day. That was the biggest thing. I stayed focused, and I surrounded myself with like-minded individuals that would also study and work in the same manner. So that's what made it kind of easy, and it also made it kind of fun, too. I will have to say, though, it was a journey. So it was 6 years, and then I received my doctorate, and that's why I call myself Dr. Andrea Ducey, because it was 6 long, interesting years. And here I am today. But before I get into what I actually do, how many of you know what a pharmacist does in general?
Kind of thinks they know, even if you can't. Yes, you can make medicine.
That's one aspect of the job. Anybody else?
Anyone else have any ideas?
Anything, I guess.
You can help people what they need for medicine.
Yes,
Yep,
that's
exactly.
a really good
Help
one.
them decide
actually.
what they need,
Yeah,
based
yeah.
on their symptoms.
Like, without those things, like,
Yeah! Oh my God! You got the big one! Did you get your flu shot from pharmacist? Is that what you do? Not yet. Yeah. That's a new thing. We can get flu
You got
shot.
one? Okay. Amazing. Yes.
That's a good one.
That's a really good one.
Yeah.
Okay. So yes. So a pharmacist. Those are all aspects of. So like Emery was saying, pharmacists can actually. She works in the hospital and in the community setting, but pharmacists can actually work in a variety of settings. They can work for the government.
They can work for the FDA and help get new drugs approved.
There's nuclear pharmacy where you're dealing with radioactive medicine. You know, there's so many different aspects of pharmacy that a lot of people think healthcare and they think nurse, doctor.
Yeah.
But there's pharmacists.
Pharmacists, I know.
And
it's a lot.
we're actually very accessible.
Yes, yes,
so,
we are.
so all those things you said about what pharmacists do is exactly correct. But think about when you go to the doctor's office and you're sick and your doctor says, I want you to take this medication. When he writes that medicine, he sends that medication to a pharmacy.
Yes.
He sends it through this electronic portal or whatever, you know, I get prescriptions sometimes from Florida and I'm like, they can do it,
Yeah.
yes. So we get that prescription, I look at that prescription, it might be for Roy Johnson or something. Roy Johnson, 16-year-old kid and he's getting a prescription for pain medicine maybe. I gotta look at that prescription and I gotta say, one, is this prescription safe for Roy Johnson to take? Two, is this medication gonna work for Roy Johnson? And three, when Roy Johnson comes to pick up the medication, I need to make sure that I counsel him effectively so that he takes it in a safe manner and that he doesn't do damage or harm to himself from taking that medicine. So the spectrum of just putting the tablets together and all, yeah, that's a part of the job, but that's a very small part of the job. The community pharmacy aspects involves a lot of people interaction. You have to be patient, you have to be willing to help, and you have to also sometimes be willing to lend an ear. You sometimes become your community counselor.
Yep.
And you get people coming in and they tell you stuff about their lives and things that have nothing to do with medication. But at the end of the day,
Yep.
it's the thorough experience when they come to the pharmacy that ultimately helps them feel better. So, now, I would have to say, onto the flu shots. So, we also do give flu shots as well. We give pneumonia shots, we give shingle shots, we give tetanus shots, we give hepatitis shots, we give meningitis shots. We basically give any vaccine that you can imagine also at the pharmacy. So, we're starting to get into more of, I guess you could say, a medical doctor involved.
Yeah.
And ultimately, we still have the title as pharmacist.
Kind of like a primary care physician. We deal a lot with like family medicine in that we help people with like chronic disease states like high blood pressure or high cholesterol or asthma. You know, those are a lot of the disease states we see. And you know, like Andrea was saying, sometimes people will come up to me in the pharmacy. They don't even have a prescription they want to pick up. They just kind of want to talk to someone, or they have like a cold or an itch somewhere or a weird rash. I've had people lift up their shirt like, "Can you check out this rash? I don't know what it is."
I've had someone put their foot on my counter and say, if this was a fungus or if this was, and you have to brace yourself
Yes.
because you can't say, oh my gosh.
Yeah, you can.
You gotta kind of say, sir, first and foremost, this is the pharmacy, not the office. Please put your sock back on. And I can show you something that might help, but you really should go to a doctor if you're worried and it's something that you've been managing for, the past couple of days or more than that. So you get an exciting kind of day-to-day with the pharmacy. It's actually,
You see a lot in community.
You do. You really do.
You see a lot in hospital too, I haven't really talked much about what you do in the hospital, but it kind of depends on where you are.
What were you doing in the emergency room?
Well, in the emergency department, when patients came in, you might come to the ED because, you have a really bad headache or your nose won't stop bleeding, or people come in for heart attacks, that's pretty serious. But basically what I would do is I would go into the patient's room and I would interview them and ask them about any medications they were taking at home, and I would make sure that I had the correct medication list so we didn't give them anything that they weren't supposed to be taking, or we didn't give them a dose of something they already have, because there are some medications where if you already took a dose today, if you take another dose, you can have severe consequences, because medications, that not all of them are, you see a lot over the counter like Tylenol, ibuprofen. Those ones we can count on people to take properly, but a lot of prescription medications, that's what the doctor actually writes your prescription for. You need a pharmacist to fill it before you can get it, because we have to make sure that the dose is right, that the amount is right, that the dosage form is right. So there are a lot of important things we're looking for in that prescription. So in the ED, I would interview patients a lot. When I was on the floor, like the pediatric floor, that was really cool because I got to round with the doctors and nurses, and rounding basically means as a group, we go into the patient's room, someone will present the patient, basically be like, this is blah, 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 they're here for this is what's going on with them, and then the doctors would kind of, try to figure out what's happening with them, and then the pharmacist would come in and be able to tell the doctor, what medication they should be on, what dosage should be, any type of things you want to monitor for, any side effects, kind of like what they're doing in community, but right at the point of care with the doctor. So it's pretty cool, it's something I've really been interested in. But I love community because you get to talk to a lot of people, and I'm a big talker.
Talk to the
and you get to see people, and it's a lot of patient interaction. So if you're someone who likes to be around people and talk to people, community is definitely for you.
But there's a lot of different facets, like we said. And another big part of my job actually is something called medication therapy management. Does anybody know what that is? Anybody want to take a guess on what that is? Well, guess what? I'm going to call somebody. What do you think medication therapy management is?
Anything. You can say anything you think of.
That's good.
That's exactly
That's
part of
good.
it.
That's
Yeah.
really good. Yeah.
Yeah.
So medication therapy management is basically what she said. It's helping patients manage their medicine and making sure that they're taking the right dose, they're taking it at the right time, and they're taking it the exact way that the doctor prescribed. So that's a huge part of my job. And the reason I like that is because I get to sit down just like the way you guys are with the person. And I mean, you guys are probably not taking medicine, or you probably don't see people taking medicine as much. And if you do, it's probably more so like your grandparents or your parents and whatnot. But those are the people that I would get to sit down with, and I say, Judy, you don't need this medicine anymore because your blood pressure or your blood sugar is where it needs to be. So a big part of my job too is not just putting people on medicine, it's getting people off of medicine. The entire collaborative care, making sure that the person is getting what they need when they need it. We're not overdosing, we're not underdosing, and we're managing the whole entire disease state. If someone's not feeling well, we're not just saying, take this medicine and feel better. No, until they feel better, I'm there at every step of the way. And that's why I like to be a pharmacist, because you kind of get to see the end result, the end goal. Sometimes when you go to the doctor, your doctor might not know if you ever got better. But at the pharmacy, I have that opportunity to follow up. And every impact and every intervention makes a difference. So I go home at night and I'm like, I did good. So it's a good feeling when you get to help people and you get to assess how well you were able to help them too. So it feels good. Okay. So,
Anyone have any questions?
questions?
What happens if you're underdosed?
So that's a good question. Depending on what medicine and what it was used for, let's say a mental illness, right? And they give that person a medication to help with mental illness. That means to help the brain function and work better, back to the normal streamline of things. And they underdose. They give somebody a medicine that's too low. That mental illness might not go away. And depending on what that mental illness is, it can cause that person to act out from that mental illness. And that person's mental illness not being managed by their medicine, that can be a huge problem for the quality of life for the person, for the people around them. And that's why it's so important for the pharmacist to intervene and say, okay, Lisa, you have this going on and your doctor's calling this in for you. I don't think this dose is high enough. Let me call the doctor and make sure that this is a better dose for you or better medication for you. So that's why there's so many multitudes of checks and balances system, because it's no joke when you're managing people's medicine. Because medication is safe if taken correctly. If not, the dose may be poor.
I've seen that happen sometimes. I've actually seen someone get the wrong medication, which is a huge error. Doesn't happen often because there's so many different verification steps. We have to know your name, we have to know your address, we have to know your date of birth to make sure we're giving you the right one. But luckily in this case, they actually called because they were like, my name isn't on this. They were like, they got home and they were looking at it and they were like, this isn't me. So they were able to bring it back in and we gave them their medication free of charge. But yeah, I don't know if you've ever seen someone get an underdose or overdose.
Yeah, I've actually been a pharmacist for about 4 years or so now. And in my practice, I've definitely seen people get, not the full quantity of medication. I've definitely seen people get the wrong medication. I've definitely seen people get the wrong dose of the medication. Luckily, in my career, I haven't seen anything too bad happen when this happened. Most of the time, if the patient is aware, they'll look at the bottle and they'll say, I'll call the pharmacy and see what's going on. Sometimes you don't get that, and they continue to take their medicine. If they're elderly, not reading it, and they just continue, and then something happens, and then we find out then. But like Emery mentioned, there's so many checks and balances system to avoid that from happening, so that we can make sure that when you leave the pharmacy, you're getting the most safe and effective product to help manage whatever disease state or situation. Yes. You do. And recently we've been having a lot of shortages actually in the pharmacy.
What's the question?
Do you ever run out of medication?
Ooh.
Yeah.
Yes, it's a very, very, very common thing. Recently we've had a lot of shortages, we've had a lot of recalls, and what that means is when a manufacturer that makes a drug notices that there's an impurity or there's an issue with the medicine, they decide to recall everything that's on the shelf. People are still taking this medication, So that happens very, 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 very regularly, and it does make it tough to manage medicine in those type of times. And that's where the pharmacist has to call the doctor and say, look, Dr. Smith, Mrs. Johnson's carvedilol blood pressure medicine is out of stock. Can we change her to a different medication that's just like this? So it's a collaborative healthcare process. Yeah.
Have you ever lost someone's medications? Like, have you ever, run into someone that they got a lot of help?
That's happened to me actually.
Yeah.
We have different bays where we put people's prescription in it's alphabetical order, so all the last names is A go here, last names is B here, and so on. So like you said, sometimes when people are putting away medications, like what are two letters that look similar? Oh, like maybe like Q and
L and
O,
I.
or L and I. Someone might put someone whose last name starts with O and the Q, or whose last name starts with I and the L. And or if someone's there to pick up and we can't find their medication, and people get a little bit annoyed sometimes, and they're like, where's my medication? Most of the time we've been able to find it because it just was in a different bay. But at the times where we couldn't, we usually would just kind of fill it again and give it to them, and then if we found it later, we could put it back on the shelf. So that hasn't been too big of an issue. I don't know if that kind of is what you do with it.
Yeah, well the thing with medication too, there's a lot of different checks and balances in the pharmacy to prevent medicine errors. The spelling of medications that are similar, they're often capitalized so that as soon as you see it, you know that this distinguishes it from this. When it comes to patients' medicines, the last names are usually capitalized as well as
across the
bolded,
top.
so that you can quickly spot it out and grab it.
Yeah.
And then you can definitely know where things are. But I just have a quick question. How many of you guys are actually interested in math or science?
Yeah. Nice.
How many are not interested in math or science? So that's the great thing about pharmacy. You don't have to be, okay, I'm such big on science, or I'm so big on math,
You
or
don't.
I'm so big on biology. If you are, great, even better. But even if you're not, let's say you're somebody that's into the arts, or you're into the social
Or reading.
sciences, or
I love
reading. Pharmacy has all those aspects. When you're working with people on an every single day-to-day basis, you need to have all those skills. So yeah, you need the math and the science to get the grades, to learn the medication, to know how it works, to understand that, but you also need to have people skills.
That's a big
And
thing.
you need to be able to, not only be patient, but empathetic to everyone's situation and plight. And you guys see what's going on today. It's not pretty. So you have to be able to stand on that platform and ready to help on that. And go, yeah, go ahead.
Have you ever not, forget to give somebody their medications?
Have I forgot to give someone their medicines? What do you mean, like if they
Like, you just forget to give them the medication?
That's happened before. Oftentimes, insulin. Is anybody familiar with diabetes?
Oh, nice.
Nice.
Yeah.
So another big part of my job is I am a diabetic coach. So people that have diabetes, I sit down with them one-on-one every single week, and I help manage their blood sugars by helping them test their blood sugar and take their medication the right way. Insulin is stored stored in the fridge.
Yeah.
It's a drug that's used to help bring down people's blood sugar or manage it. Oftentimes, when you have a label,
Yep.
you go get the label from the bin, you bring out the customer, and you might forget to
The insulin's still in the fridge. That's happened to me.
It happens like all the time.
Yeah.
And that's another time the customer will probably get home and say, where's my insulin? I paid $50 for this. So yes, it happens, but we all make mistakes, and as long as you
Just own up to it.
own up to
Usually
it
okay.
and apologize,
Yeah.
you're good.
Does anyone have one final question?
Any burning, dying questions?
Anything at all?
Anything at all? Comment, concern?
Yep. Any comments you want to make?
Well, thank you guys.
Thank you for having us,
And I
guys.
really appreciate it.